Probably for the VA claims process, the most study that most the physicians are going to look at are going to be the X-rays.
Open ranks, on!
Hey, what's happening? This is Jerome, president and founder of Open Ranks Nurse Consulting, and today I have on the channel with us Dr. Drew Mosier. He is a radiologist here at Madigan Army Medical Center. I met Dr. Mosier in my reserve unit. I always noticed that he was very willing and able, obviously, to discuss his craft, the radiology craft. And so today, I want him to talk to you guys about the findings of what is really a radiology study. What are the different components of a radiology study? How do you approach the doctor, your primary care physician, your treating physician, in order to get more understanding of it, so this way you can advocate for yourself. So as we tee this up, Doc, I want you to do just a quick, brief introduction to yourself, and then we'll get into the rest of the discussion. You got the floor, Doc.
Hey, thanks a lot, Jerome. I appreciate it. So yeah, my name is Andrew Mosier. I'm currently a radiologist working at Madigan Army Medical Center. I had done actually my radiology training at Madigan Army Medical Center, and then was sent to a year to do diagnostic studies at Fort Knox. Then I had the opportunity to go to Cleveland Clinic and do a one-year fellowship. Got back here to Madigan, and they said, welcome, and we're going to have you go deploy for 9 months in Djibouti. And then I came back to Madigan, where I spent half my time active side, half my time reserve side. And currently I'm working still as a civilian radiologist at Madigan and just about to close out my reserve career in the Army. But with that said, that will just lead farther into radiology.
Well, you're almost done. You're about to retire here shortly, correct, sir?
Yep. Yesterday, I got to 20 years.
Oh, man, congratulations. Congratulations. I know that was a big feat, but we're glad to have you here, and I'm quite sure that the audience will definitely appreciate the value that you can bring. So Doc, let me ask a couple of questions, and let me just tee this up for the audience. Many veterans and service members have kind of sent me messages on the side and say, "Hey, look, I'm trying to advocate for myself with the medical record. I really, first of all, there's a couple of problems with me understanding the medical record. What are the major components of it? I hear that I have to have, objective findings. I really don't know what that means. There's a lot of medical ease inside of the record that I don't understand, to include the radiology studies, which I just skip over and don't add as evidence because I can't understand what is being said there. So could you kind of tee up and kind of help us walk through at a 25,000 foot view, because I know that you can go down to the to the lower levels, how someone like a veteran and a service member can at least begin to approach understanding the medical aspect of the radiology studies? Like, what are the different types, things of that nature?
Yeah, sure. So we're going to, in radiology, perform about 5 basic studies, and I'll name them, and then I'll go back and talk about the importance of each one, especially in regard to the VA claims process, which is what I hear to be one of the main questions. And so we're going to perform X-rays, which are a 2-dimensional, either back to front or side to side or angled look, oftentimes for the VA claims process at a joint, the elbow, the knee, the wrist, the ankle, the hips. And we're going to gather information based upon a 2-dimensional image and give an interpretation for that. The 3-dimensional version would be the CAT scan. And oftentimes the CAT scan in the past hasn't been used a lot to look at joint injuries, but more for emergency type purposes, for the chest, for chest pain, or for the abdomen, pelvis, for that pain in that region. But it is playing a tiny bit more role lately in orthopedic or joint imaging, oftentimes centered around fractures or joint replacements. And then we have MRI. MRI is basically going to be used for joints to further look into joint injuries on the ligament or tendon level. It also can be used on the soft tissue level to look at nerves or nerve structures such as the brain and spinal cord. We're going to have ultrasound. Ultrasound is not going to play a terribly large role in the VA claims process per se, because oftentimes we're looking at organs inside the abdomen and pelvis, and it's yet to find its realm to be very diagnostic in the musculoskeletal region.
Mm.
And then we got bone scan. Bone scan is often used to look for stress fractures. And obviously, long marches can create stress fractures. Obviously, there's other reasons militarily that we could obtain a stress fracture, either they're in our lower shin region or in the bones of our feet. And but probably for the VA claims process, the study that most the physicians are going to look at are going to be the X-rays. In large part because the physicians in the VA claims process probably understand X-ray the best, since they aren't radiologists per se, but have had some radiology training in medical school. And also because if they can pull open an X-ray, they can see for themselves what we're talking about on 1 to 5 images. Whereas if they pull open a CAT scan or an MRI, they're going to be left scrolling through 500 to 7,000 images, of which they probably, one, don't have the time to do, or two, don't have the eye to pick out the exact 1 out of 7,000 images that we're talking about something could be going on. So
Okay.
Heading back to the X-ray portion is for pain, especially at the joint level. What the VA claims radiologist is not, I'm sorry, the VA claims physician is probably looking the most for is for the words moderate or moderate to severe or severe degeneration. And the reason I say that is because a lot of the radiologists, we will put in our description, we'll put mild or very mild or mild to moderate degeneration. And oftentimes that could be secondary to a process that occurred prior to military service or perhaps from childhood. But once you start getting up in that moderate range, the physician doing the VA claims process is probably going to more likely chalk up moderate or moderate to severe or severe to something that occurred in military service.
I see. Okay. So let me take a step back and make sure that we level set. So there's, if you were to think of a hierarchy of in terms of radiology studies, um which, so are you saying then the X-ray would be probably the first level of approach, maybe then a scan, a CT scan, then a MRI, bone scan, things of that nature? Is that, how would you categorize the hierarchy? And then what what does each of these look for?
Oh no, that's a really good question. So the first part is, do you have wording that the VA doctor can stop on the conclusion of the X-ray report that will just verify what the service member is already saying, which is that, listen, doc, I got pain here in my knee and it's service related. And if they pull open an X-ray report and it says moderate or moderate to severe knee joint degeneration, that's going to be confirmatory enough. They're not going to need to dive in much farther. What they will probably do is they will probably get a third party X-ray to confirm it. Oftentimes at the occupational health clinics surrounding VAs or VA centers. But once that confirmatory study comes in and they say something similar, then that's going to be enough for the VA claims radiologist who's reviewing it to say, yeah, that's legit.
Okay.
But there are very real cases in ligament or tendon injuries of the joints or in back pain where there may be another study that needs to dive farther into it. And so, say, going back to the knee, if you have pain in the knee, but say, for instance, your X-ray is relatively negative, not too many findings on it or none at all, and you're like, but I still have pain. This is where I would say the second next study that the VA claims radiologist or doctor is going to look at is going to be the MRI. The reason I say that is because you can tear your ACL, you can tear your meniscus, you can have some pretty significant meniscal degeneration in the knee, or you can have some large disc herniations in the back that aren't going to show on the X-ray. Yeah, so I would order probably X-ray, and then for when the X-ray can't confirm the retiree or service member's pain, then probably MRI is going to be the next go-to study.
And so the X-ray would look at just. Are you saying the X-ray would look at bones predominantly, and but not anything with ligaments or tendons or anything of that nature? Is that correct? Well, from an X-ray,
Yes.
okay. And then with the MRI, it does a. So explain the MRI, right? Because I think there's just a little bit of confusion amongst the veteran space of, oh well, I got a picture. They'll say I got a picture of my knee, and the picture said that there was a fracture. Well, was that an MRI? Yeah, yeah. The doctor said it was an MRI, but the picture actually, when you review the medical record and you see the impression is actually talking about two views, and it's talking about an X-ray. It says X-ray right there. So there's some confusion around it. So basically, what I'm trying to ask is, what is the X-ray review and does not review, and then what is the MRI review and doesn't take into consideration?
Yeah, so the X-ray is going to look at long-standing changes in the bones, and so that's why you're going to see that word degeneration or arthritis, or sometimes we'll put in the
Mm,
term osteo, meaning bone osteoarthritis. And so the X-ray is reviewing long-standing changes, which is why the X-ray is pretty confirmatory once you get to that moderate or above level. But diving further in is when you haven't had time enough for those secondary changes to take place on the X-ray to the bones. Is you're going to start looking inside of the soft tissues, and that's where the MRI comes into play. And
got it.
both a CAT scan and an MRI is going to look like you're being placed inside this large giant donut.
Um,
The CAT scan is going to be relatively quick in comparison to the MRI. It's going to run you through in 2 to 5 minutes or less. And the MRI, you're going to be inside it for probably a good 12 to 25 minutes. It's going to be really loud. They're going to have probably placed headphones on you to drown out that noise. And you're going to hear a lot of popping and knocking and clicking going on, which are the different MRI components taking place. And so to try to understand once you've gotten beyond the X-ray process, which if you've had a CAT scan or MRI, CAT scan's quick and not noisy. MRI is a lot longer, and it's going to be really noisy to the point where they're going to put headphones on you to drown out that noise.
Okay. And so with the CAT scan, what is the CAT scan actually? What is that? What is the CAT scan?
It's going to be three-dimensional X-rays, and in the world of joint imaging, it doesn't come into play as much except for fixing fractures or
Hmm.
prior to a joint replacement. And if you've gotten to that point as a service member or retiree, then you have enough radiology reports to show like, yeah, fracture due to this reason, joint replacement due to moderate to severe arthritis or degeneration. And so your CAT scan, your joints aren't going to play as much into the VA claims process as will your probably tens or 20s of x-rays of that same joint leading up to that point. In fact, it'll be a good record to show that you truly do have the end result of damage to a bone or to a joint.
No, that is good. That is very good information, and thank you so much for breaking that down for us because that is one of the problems that I find in talking to veterans. There's that little bit of and service members. There's a little bit of that confusion around those different types of studies.
Close ranks, march!